Our objectives for today: to be able to discuss the most common rhythm disturbances and to identify key characteristics of normal and abnormal rhythms.
A normal heartbeat produces a regular identifiable pattern, the P wave, the QRS complex, and the T wave. These segments show the electrical activity of specific parts of the heart. The normal pattern of electrical activity that is seen on electrocardiogram, or ECG, is called a sinus rhythm. The SA node is the normal pacemaker of the heart. It begins the heartbeat by producing an electrical signal. This signal spreads through the atria, or upper chambers of the heart, causing them to contract. Electrical activity in the atria is seen on the ECG as the P wave. The signal then reaches the AV node, which transmits the electrical signal that continues through the bundle of His, the bundle branches, and the Purkinje fibers. This causes the ventricles, the lower chambers of the heart, to contract.
So now let us talk about the segments and intervals in the EKG diagram. There are a bunch, starting off with the PR interval, the PR segment, the QRS complex, the ST segment, and the QT interval. But to make it easy for you guys, we are just going to talk about the PR interval and the QRS complex. These are all we need to do the EKG interpretation. The other segments, they are important too, but we don't really need them to interpret an EKG faster and more efficient. So this is your typical EKG strip. In an EKG strip, we have a big box. And inside a big box, we have 5 small boxes. Each small boxes is equal to 0.04 seconds. And so if in a big box there are 5 small boxes, that means that one big box is equal to 0.20 seconds. But really, as long as you know that one small box is 0.04 seconds, we're good to go. So let us get on with our 6-step EKG interpretation. First up, we have to identify and examine the P waves, measure the PR interval, measure the QRS complex, identify the rhythm, determine the heart rate, and interpret your strip. And we're going to talk about them one by one. Let's start off with identify and examine your P waves right here. The normal P wave would be present and upright. If the P wave is absent or inverted, then it could indicate a form of dysrhythmia such as a junctional rhythm. Next up, we are going to measure the PR interval. PR interval is the distance between the beginning of the P wave and the beginning of the QRS complex. What we do is we count the number of small boxes in between and multiply it by 0.04 seconds. Our magic number for the PR interval is 0.12 to 0.20 seconds. Anything more than 0.20 seconds could indicate another dysrhythmia such as heart blocks. Third would be to measure the QRS complex. Just like the PR interval, we are going to measure the small boxes in between the QRS complex. Our magic number is 0.06 to 0.12 seconds. Anything more than 0.12 could indicate a dysrhythmia such as a PVC. Number 4 is we have to identify the rhythm of our strip. It could be regular or irregular. And the way we do this is we measure the distance between Rs. Rs and Rs. Some people use calipers to do this, but really all you need is an index card. Mark your Rs and march them with the rest of the Rs. If they have the same distance, then your rhythm is regular. Otherwise, they are irregular. Fifth step is when we identify our heart rate. Now, before we calculate our heart rate, it is very important for us to know that our EKG is a 6-second strip. And the way we will know this is when we find these 3 lines right over here. If you see these lines, this means that from the first line up to the 3rd line, that would be your 6-second strip. The reason why this is important is that if it is a 6-second strip, then we can do a technique called the 6-second method. And the way we do this is that we count the number of R's between these 3 lines right here and multiply them by 10. So for this strip, we have 1, 2, 3, 4, 5, 6, and multiply that by 10. That will give us a heart rate of 60 beats per minute. One thing to remember is that this method works best for irregular rhythms. And another tip that I can tell you is that you have to be very, very careful in using the 6-second method. You always have to verify that the strip that you're reading is indeed a 6-second strip. I know some teachers include strips that appear to be 6-second strips, but they're really not. They don't have these 3 lines right here. And students actually mess up the heart rate because they use the 6-second method. This method only works for 6-second strips, okay? Second method that we can use to calculate the heart rate is the big box method. And the way this works is that we divide 300 by the number of big boxes between 2 R's. Our magic number is 300. So for this strip, we are going to use these 2 R's right here. So we have 1, 2, 3, 4, 5 big boxes in between R's. And so, using the formula, 300 divided by 5, we have 60 beats per minute. This method works better for regular rhythms only. And this is actually the method that you can use if you don't have a 6-second strip in front of you.
So the first step here is to figure out which peak is the
1500
best to look
method.
at. And it looks like I have 7 to choose from, but I'm actually going to pick this one right here. And if you can, the best peak to use is the one that is right on one of these solid lines. So the first thing I'm going to do is I'm going to count the number of small boxes between the peak in question, this one right here, which is in the red box, and the peak adjacent to it. Okay? So remember that from solid line to solid line, this is 5 small boxes. So this would be 5, 10, 15, 20, and then there's one more small box right there, so 21. And what I'm going to do is I'm going to take 1500, always this number, and divide by the number of small boxes that I counted. And that's going to be my heart rate in beats per minute. So I counted that there were 21 small boxes between this peak in question and the peak adjacent to it. That's my RR distance. There's 21 small boxes. So I'm simply going to take 1500 and divide it by 21, and that's going to be my heart rate in beats per minute. And I get roughly 71 beats a minute. When you do this calculation, you're going to get about 71.4. And since we can't have fractional or decimal heart rates, you just round it to the nearest whole number. So 71.4 beats per minute will be 71 beats per minute. And that's the 1500 method. So